First of all, perhaps a bit of background about the INO-VATE study. So this was a Phase III randomized study comparing Inotuzumab with investigator choice standard of care in relapsed refractory ALL. It was a one-to-one randomization of about 320 patients. And the overall findings were that there was a very significantly higher complete remission rate with Inotuzumab, and there was better overall survival. So when this was published in the New England Journal, the survival curves for most patients only went out a couple of years. And there was some controversy about overall survival because the curve was of an unusual shape. The survival was better in the Inotuzumab arm by 1 month, but the p-value was 0.04, and because of there being two primary endpoints, the p-value it had to meet was 0.02. However, there was another way of analysing the curves, and that was to do a restricted mean survival time, and that showed that that was 4 months better in the Inotuzumab arm, and that was significantly better. What we've done more recently is to look at updated, more prolonged survival. We're now able to reliably analyse 3-year overall survival. And this is about 20.5% in the Inotuzumab arm and 6.5% in the standard of care arm, and those are statistically significantly different from each other. There's been some further work at looking at subsets of transplant patients and looking at various groups of them for survival. So first of all, if you look at all allograft patients, the survival was about 41% at 2 years. If you look at the group who proceeded directly to transplant, that was a bit higher, it was 45%. But there was an even better group, a group who were MRD negative and went straight to transplant after Inotuzumab, and they had a quite impressive survival of 51%.